heart beats about 100,000 times every day. And with each beat, tiny valves in your heart muscle open and close, sending blood down different paths to all areas of your body. Well, doctors have discovered that many people who experience chronic fatigue and other subtle symptoms actually have problems with their heart valves. Take a look.
30 years, that's how much longer the average human lives now compared to just a century ago. And at age 64, attorney Larry Kesnick is going strong. The question is, can his heart go the distance too?
I would always bend over backwards to take pretty good care of myself. And then in the course of a physical examination, I learned that I did have a big problem.
Normal hearts beat with consistent rhythm.
We've all heard the sound, lub-dub, lub-dub.
But recently, Larry's doctors picked up something odd. His heart rhythm sounded off.
Lub-dub, shh, lub-dub, shh. The blood going through this makes an unusual sound.
To a trained ear, that sound might as well be an alarm. The sound of a leak in the heart's plumbing, more specifically in one of the 4 heart valves.
And these valves are more like trapdoors. They open and shut. And when one of these trapdoors breaks, it can't shut properly, and the blood goes in the wrong direction.
It's not an issue of lifestyle. Cardiac surgeon Junaid Khan explains valve problems stem from things you can't control, a sudden illness, or a birth defect that may not even show up for years and can sometimes be quite serious.
The heart fills with blood, and then it pumps that blood to the rest of the body, including your brain, your kidneys, all your critical organs. The valve then closes to maintain pressure in those organs with the blood. If that valve is leaking, the blood will go in the wrong direction.
Symptoms can be subtle, fatigue or a shortness of breath, or in Larry's case, no symptoms at all.
And I've just never really thought about my heart, to be quite honest with you. It's always worked just fine.
In the past, doctors waited for symptoms to operate, but now they're much more aggressive.
If we don't fix that leak, they have a 1 in 5 chance of dying in 5 years, and that's huge.
It's a shock. If I had the procedure, that then there was every chance to believe that I would then be able to live out my normal lifespan, whatever that might be.
It's a challenge convincing patients who feel fine that treatment can be highly beneficial. In true attorney fashion, Larry deliberated over the evidence, weighed the options available, and then reached a decision.
My mind was made up that I was going to have the procedure.
It's all about timing. Catch the problem late, and doctors may need to replace the entire valve with one of these, a pig valve or a mechanical valve. But
you want to go to a place that can do a repair, because a repair is far superior than a replacement.
Larry's heart had swollen from the strain, which in turn strained the cords that hold the valve doors in place, causing them to fly free. And that explains the leak. Working through a smaller incision on the side of the chest, Dr. Khan anchored Larry's valve doors back down using surgical cords made of a material you may have heard of, Gore-Tex.
The working end is down here. However, my hand is way out here. Allows my hands to stay outside the body.
Next, Dr. Khan pulled the stretched valve back into its normal shape and tied it around this surgical ring in a fast-healing procedure that had Larry back in action in no time.
Mr. Kesnick was on the phone the day after surgery conducting business against my advice.
I'm self-employed, so I didn't want to be out for 2 or 3 months.
We had multiple people go back to work within a week after surgery.
The biggest benefit for Larry? Peace of mind.
It's been 2 months. I feel really good.
Now this high-powered attorney knows his heart has enough staying power to keep up with him, and he's more determined than ever to take care of it.
Realizing that I am okay, and that I'm recovered, and that it worked out well, and I just feel very fortunate.
Want to know how hard your heart has to work? Take a tennis ball and give it a squeeze. Your heart has to pump with the same strength as your hand and do it more than 2 billion times over a lifetime. Now there's some motivation to take care of your heart.